Bladder cancer. Bladder cancer is the fifth most common form of cancer in the United States. Most of the time, bladder cancer can invade not only the bladder, but nearby lymph nodes, surrounding tissues, and other organs. When local measures such as surgery, immune therapy, or chemotherapy doesn't help, the most effective option to treat bladder cancer and reduce the risk of having a tumor recur is to perform a radical cystectomy. What is radical cystectomy? A radical cystectomy is a procedure where your entire bladder is removed, as well as any nearby lymph nodes and organs that may also have cancer cells. In men, the prostate, the seminal vesicles, and part of the vas deferens are also removed. In women, the cervix, uterus, ovaries, fallopian tubes, and part of the vagina are also removed. The purpose of the procedure is to clean out the pelvis and rid the body of cancer. Procedure. The radical cystectomy surgery takes anywhere from 2 to 4 hours. You will be given antibiotics to prevent infection before the operation. To perform a radical cystectomy, a small cut or incision will be made in your lower abdomen. All blood vessels going to the bladder will be tied off, and the bladder will be removed, along with other parts of the body that may contain cancer cells. The doctor will then use a piece of your small intestine to make a conduit or tube that will carry urine out to an opening in your belly. The urine is then collected into a plastic bag that is connected to your skin. This method is referred to as an ileal loop. If medically appropriate, your surgeon might offer you a neobladder. This is done by creating a new bladder using a segment of bowel, then connecting it to your urethra. An advantage of the neobladder is you won't have to wear an external appliance. However, this is associated with a higher risk of complications and a longer recovery. You may also experience urinary incontinence and in some cases may need to self-catheterize to empty your neobladder. Another option would be to do a catheterizable stoma, where a catheter would be placed into your abdominal wall for bladder drainage. Both of these options are much more complicated and can cause issues in the future, which is why we typically try to do the ileal loop. Risks and complications. As with any major surgery, complications may include heart attack, stroke, a pulmonary embolism, which is a blood clot to the lungs, bleeding, infection, and wound complications. Other complications may be metabolic acidosis, which is an imbalance in electrolytes, leaking urine or stool, bowel obstruction, or a kidney infection. These complications are typically short-lived. You will continue to receive antibiotics to prevent infection after the surgery. Signs of infection may include fever and chills, redness, swelling, heavy bleeding, or discharge from the incision site. You should notify your doctor immediately if these signs occur. The biggest complaint from patients is waiting for their bowel function to return while in the hospital and getting used to an outside appliance or urine bag. Long-term problems may include an obstruction of the ureters, which could cause kidney failure, problems with the incision site, or the development of scar tissue inside the intestines causing a blockage. A radical cystectomy will also affect fertility. Since major reproductive organs like the prostate and uterus are removed, you will not be able to have children. This surgery may also affect your sexual function. Having sexual intercourse may be more difficult for a woman who has had part of her vagina removed. Many men experience erectile dysfunction since the prostate and seminal vesicles have been removed. Each patient is different, and you should talk to your doctor about any concerns you may have. Prepping for the surgery. Several days before surgery, all blood thinners are stopped. Please ask your physician about specific medications to avoid. As with all surgery requiring a general anesthetic, please do not eat or drink anything after midnight the night before your procedure, and you must arrange for transportation after the procedure. Postoperative recovery. After your surgery, you will stay in the hospital until you have your first bowel movement. This can take 5 to 7 days, but could take longer depending upon the patient. During this time, you will be in some discomfort, but that will be managed with pain medication. After being discharged from the hospital, it will take up to 3 to 6 months to fully recover. You will be prescribed oral pain medication. Please restrict your activity level with no heavy lifting or straining. Drink plenty of water to keep you hydrated and eat a soft diet. This will help in getting your bowel function back to normal. After your recovery, you should be able to resume normal activities. Some patients may require more treatment, like radiation or chemotherapy. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure.